Hi, my name is Dr. Brito from Scottsdale, Arizona, and I'd like to discuss genomic testing with Decipher for patients that are high risk for recurrence or subsequent metastatic disease post-radical prostatectomy. Now, today it's a dilemma because we're trying to decide the timing of patients who pathology suggests that they're at higher risk. Now, there's AUA and ASTRO guidelines suggesting earlier is better than later. But the question is, do you just treat all patients that may have a positive margin or high-risk disease? So that's where we're trying to personalize healthcare, and looking at genetics is a big part of the future of our care. And with Decipher, it's the only one currently available that looks at the genomics of the pathology to kind of help better define who are truly at higher risk for subsequent metastatic disease. Our group participated in a clinical utilization trial where we looked at pre and post Decipher score and trying to help us decide, did we better appropriately decide on early versus delayed adjuvant therapy for these patients. And what we found was the percent of our patients treated afterwards didn't really change. But when you looked at the patients that did get treatment, a lot of those were at moderate to high risk patients, which we would think would be the more appropriate patient to do. But our decision making did change by 28%, but the percent of patients requiring treatment didn't. And it does give you better confidence on trying to make that decision. Now today, we really want to personalize the treatment of patients. And not every patient responds the same way. Someone may have a positive margin and never have any kind of biochemical recurrence. And then those are patients that go on and can develop metastatic disease. So if we can better define that, that only helps our patients. The other thing is today you have to be cost conscious and really decide, what is appropriate treatment versus treating all patients. And there's criticism that prostate cancer is overtreated, but it's also one of the higher causes of death in men, for malignancies. So using Decipher, it's one of the tools to help better define that. And this way, we hopefully can really treat early on the patients that really need to be treated early and be able to observe and monitor the patients. Now, to be able to do the Decipher genomic tests, they have to look at the whole sequence. And so there's a part of the test called the grid that currently is for research use only at this time, but it may find other markers or sequence abnormalities that down the road our patients who fail other therapies may be candidates for different systemic treatments. So my recommendation is consider other tools when you're trying to decide on patients versus just biochemical recurrence, and Decipher genomic testing is one of those tools.